Now, let's turn our attention to stimulant use disorders. What falls under this category?
So this covers illicit substances like methamphetamine, ice, MDMA, ecstasy, cocaine, but also the non-medical use of prescribed stimulants.
You mean like using someone else's ADHD medication?
Exactly, or using your own but not as prescribed, maybe to get high. And the routes of administration vary a lot: oral, snorting, injecting, inhaling.
Okay, this brings us to a crucial question. What are the most critical harms GPs need to recognize and maybe address?
Stimulant use can cause really life-threatening cardiovascular issues. Think hypertension, arrhythmias, heart attack, even infective endocarditis, especially if people are injecting.
Serious physical risks. What about psychiatrically?
Patients might present with misperceptions, delusions, paranoia, depression, anxiety, aggression, delirium, even full-blown psychosis, and always, always assess for suicide risk. That's critical.
Neurological harms too.
Yeah, seizures and stroke are definite risks, and significant sexual and reproductive health risks, too. Increased sexual risk-taking because of disinhibition.
Right.
And for pregnant patients, risks include spontaneous abortion, placental abruption, fetal harm, premature labor, lots of potential problems.
And other common harms we might see.
Severe dental damage, meth mouth, is a known thing. Infections, abscesses from injecting. Skin picking is common. And of course, bloodborne infections like HIV, Hep C.
So, how do you screen and assess effectively for these in your practice? It sounds like it could present in many ways.
The guidance suggests you routinely ask all new patients, and opportunistically, periodically, ask other adolescents and adults. Just make it part of a general substance use screen.
Normalize the question.
Exactly. Your core assessment should cover the pattern of use, how much, how often, how, and any harms they're experiencing. Look for signs of toxicity. Evaluate for dependence and withdrawal.
And the mental health aspect.
Crucially important. Screen for psychiatric symptoms, psychosis, anxiety, depression, emotional dysregulation, suicide risk, and always explore the patient's readiness for change. Motivational interviewing techniques are perfect for that.
Okay. What about stimulant withdrawal? Is it medically dangerous like alcohol withdrawal can be?
It's important to understand stimulant withdrawal is generally not medically complicated in the same way. It's usually not life-threatening itself.
Ah, okay.
However, the key persisting symptoms are profoundly psychological. Really strong cravings, deep depression, anxiety, irritability, paranoia, a motivation, that complete lack of drive, anhedonia, inability to feel pleasure, and suicidal thoughts.
And these can last a while.
Yes, they can persist much longer than withdrawal from things like alcohol or opioids.
Yeah.
It makes the recovery path particularly challenging.
And medication for dependence.
Here's another significant point. There are no drugs currently approved to specifically treat stimulant dependence itself.
Not at all.
Nope. Management is primarily psychosocial interventions, sometimes combined with medication to alleviate acute withdrawal symptoms, but things like sedatives, say olanzapine or diazepam, should really be limited to short durations, maybe a week, to reduce risks like overdose or dependence on the sedative itself.
So for long-term support, relapse prevention, it's mainly psychosocial.
That's the mainstay, absolutely. A combination of therapies, maybe for at least 3-4 months, seems more effective than just single short-term approaches.
What kind of therapies?
Key techniques include cognitive behavioral therapy, CBT, motivational interviewing, MI, acceptance and commitment therapy, ACT, and contingency management, that's using rewards for abstinence.
Okay. And for pregnant or breastfeeding patients using stimulants?
Early referral to an obstetric service that has alcohol and other drug support is absolutely essential, given the significant risks to both mother and fetus.
And breastfeeding.
Stimulants are found in breast milk. They can cause infant harm, irritability, poor sleep. If there's regular or unstable use, you should strongly advise against breastfeeding.
Right.